Joining us now from Capitol Hill is Republican Senator Susan Collins of Maine. She serves on the Armed Services Committee and is ranking Republican of the Homeland Security Committee. Senator, good to see you. Thanks so much for joining us.
Thank you.
I want to talk first about what's going on in Afghanistan and Pakistan. As you know, the Secretary of State, Hillary Clinton, is there, and she's admitted that there's this trust deficit between the Americans and the Pakistanis. There's a lot of anger from the locals. We, taxpayers, we're spending about $1.5 billion a year in non-military aid to Pakistan. How crucial is this relationship, and how crucial is it to have the support of locals? Hillary Clinton got a lot of heat today.
I give Secretary Clinton a lot of credit for pressing the Pakistanis on the issues of where the al-Qaeda leaders are hiding. I think she was exactly right to raise that issue, even if it did cause some uncomfortable moments. Those are the kinds of issues our Secretary of State should be asking.
Well, here's the question, because as we're facing perhaps these local terrorists that are born and bred in that region and are a real concern to those of us Americans, you essentially have Pakistanis telling Secretary Clinton today that there are executions without trial because of these drone attacks. I mean, one woman telling Secretary Clinton today, "It is your war. You had one 9/11. We are having a daily 9/11 here in Pakistan because of those drone attacks." Does that concern you?
Look, all of us are very concerned whenever there are civilian casualties, but those drone attacks are based on actionable intelligence, on the best intelligence that we have. They are coordinated with the Pakistani government, and they have been successful in taking out some of the al-Qaeda and Taliban leaders. Obviously, it's Pakistan itself that is taking the lead in the military operations, but part of the problem was created by the previous Pakistani government, which allowed safe havens to be created on the Pakistan-Afghanistan border. And it is in those safe havens that we know that terrorists are plotting attacks and training future terrorists. So I think we have to be tough on this. We have to coordinate our efforts. We're not trying to alienate the Pakistanis. It's in their interests as well as ours to clean out these safe havens.
So given that and what's going on in Pakistan, and then at the same time the president today holding the 7th meeting with his war council as he gets closer to announcing his decision about troop levels in Afghanistan, would you be disappointed if the president does not follow the recommendations of General McChrystal for some 40,000 troops?
The president has a very difficult decision to make. I have enormous respect for General McChrystal, and I believe that considerable deference should be given to his recommendations. But what's most important is for the president to establish clear goals and achievable goals. I don't think the goal should be to somehow transform Afghanistan into a Western-style democracy. That's not going to happen. But we do need to prevent the Taliban from establishing safe havens for al-Qaeda, and we do need to prevent Afghanistan from being the source of destabilization of Pakistan and vice versa.
Senator, I want to turn to the issue of health care. Your colleague from Maine, Senator Olympia Snowe, of course, voted for the Senate finance bill, but she says she's not going to support a bill with any public option other than, of course, a trigger. Will you abandon support for health care reform if the final bill does not include a public option?
It does not make sense to create a government-owned insurance company, and that's what we're talking about when people use the term a public option. I believe that that would drive up costs, cause people to lose insurance that they're happy with, because it would destabilize the private market. There are also other flaws with the bill, however, that are of equal importance to me. I don't think it does enough to rein in the cost of health care, and that's the biggest issue. That, to me, should be the #1 focus.
It's interesting to hear you say that, Senator, because I've been thinking that you know, you can criticize this administration in any different ways, but one of the ways that this health care could have been done is to first talk about tackling costs, and then second talk about providing more coverage to Americans. And certainly this White House is trying to do all of it at once. But Senator Susan Collins, as always, it's great to have you on. Thanks so much.
Thank you, Norm.